Hello and welcome everybody. My name's Cathie and this is...
My name's Gil.
And we're both volunteers with Prostate Cancer UK. First of all, we'd like to say thank you very much for attending this event on such a hot day. We'll try not to keep you over long. We anticipate our talk will take about 20-30 minutes. There will be time for questions at a couple of points within the talk. But if you have any additional questions that you want to ask, please pop them in the chat. And Helen, I think, will coordinate those at the end so that we can answer any queries that you have. Also, if you have any questions afterwards that you want to pass on to Helen, I'm sure she'll be very helpful in passing them back to us as well. We're both volunteers with Prostate Cancer UK, as I said. We work with the charity to help raise awareness about prostate cancer because it is one of the, it's the biggest cancer in men, and it's one of the things that men are often reticent to talk about. But what we'll do to start with is we'll go through our own story. Gil had prostate cancer in 2010, so he's 15 years on. That in itself is a very positive thing, but we'll take you through our story and then give you some facts and figures and information about prostate cancer and what you can do to help manage your own risk. So over to Gil, and if we could have the first slide, please, Helen, the second slide, sorry.
Right, well, as Cathie said, I was diagnosed back in 2010 with prostate cancer. Came out of the blue. I was fit and healthy, 63-year-old, very much involved in sport and so forth, and very seldom, if ever, went to the doctor in the previous 10 years. I was beginning to have a few symptoms that could be associated with prostate cancer, although I didn't actually at that point make that connection. Those symptoms were largely things like problems with the waterworks, basically getting up in the night more to wee, coming back to bed, then thinking, oh, I haven't quite emptied my bladder. Partly due, well, I think this is important, the role of partners, that, you know, that Cathie had said, well, why don't you go to doctors? Well, as I say, I was fit and healthy and didn't feel a need to do that. Eventually, I went with tennis elbow and spoke to the doctor and said, oh, as an afterthought, by the way, you know, and I explained that I was having a few issues with my waterworks, and he said, oh, it's probably just your age. People tend to get some men tend to get associated urinary things with their age. I'll just do you a PSA test. PSA test, I will talk about that later, is called prostate specific antigen. It just shows up from a blood test a sort of range of what would be normal and what might not be normal. So sure enough, I did PSA test and got a call to say, it's a bit high, we'd better have some other tests. So that led to me being referred, and I then went and first of all I had a biopsy, and that did show up that there was some cancer in my prostate, and then that was followed by an MRI scan. And again, that confirmed that I did have prostate cancer. As I said, it came out of the blue. It was a big shock to me, and of course to the family. But you have to get on and do things. So I then had to make a decision about my treatment options. We'll talk about that more perhaps a bit later. I have to stress again, we're not medically qualified. So we can only talk about kind of our journey, our experience. But I had the option of three separate treatments. I could have, just because it wasn't at that stage showing it was going to be particularly aggressive, there's an option called active surveillance, which would mean more tests over a shorter period of time to see if things are moving. That was one option. The other one was radiotherapy, and the third option was surgery.
I think that was probably the hardest time for Gil and for me too, was deciding finally what was the best option. I think you always want somebody to tell you from the medical profession to say, this is the best option for you. But of course, when there are a variety of treatment pathways, the medical profession tend not to do that. And you have to actually finally make and own that decision yourself. And there are pros and cons with any decision that you make.
Yeah. So in the end, I opted for surgery, which in those days it was the earlier days of keyhole surgery, which I had at the Freeman. These days it is still keyhole surgery, but it's robotic, the Da Vinci machine, which is the same, essentially same operation, but more precise. Sort of high-tech stuff. I have to say that I was assured that both the options of radiotherapy and the surgery had approximately the same benefits and the same survival rates, both of which were very good, because the cancer was caught early, and we'll be coming back to talk about how important that is as we go through the slides. Just to say one further thing is, as Cathie said, we're both volunteers with Prostate Cancer UK. Because I didn't know anything, or we didn't know anything about prostate cancer, we thought, well, there's going to be lots and lots of men out there who are going to be in the same boat. That men are not particularly active in terms of looking after their own health, or being aware of health issues or risks. So we joined Prostate Cancer UK, got some training, and decided to do work to actually try and raise awareness amongst men. And I have to say, we've been doing that for what, about
13, 14 years?
Yeah. It doesn't seem like that. And what we do is things like today, although that's less common, actually doing talks online, we can go out to companies or firms or organizations. But probably the most things we do is actually go and have awareness stands in places like supermarkets or shopping malls or whatever. And we've got lots of sort of free literature and things that we can hand out and have discussions with people. So that's kind of where my story started. I still get tested every 6 months, actually, PSA test, and touch wood, I'm all clear. I'm still fit and healthy. I'm still very much involved in active things. So that's as Cathie said, that's a positive.
Next slide, please.
So what is this is something that not everybody knows. What is a prostate? When we first came across some of the facts and figures, it was pretty staggering to get the percentage of people who didn't know what a prostate was.
Who had one?
Yes.
I mean, when we first started doing talks and stands, we were amazed at how many women didn't know only men had a prostate, how many men didn't know only men had a prostate. That has shifted a lot over time. And because of some of the high profile cases and increased awareness in the press, and through the work of Prostate Cancer UK, there is much more awareness now about what the prostate is, who has one, and sometimes what it does. But Gil will go on to that too.
Yeah, if we could have the next slide, please, Helen. Yeah, so this diagram shows you roughly the sort of plumbing, if you like. The prostate sits just underneath the bladder there, and you'll see the tube going through that prostate gland and then out through the penis, which is where you would wee. But it is also the plumbing that would lead to you ejaculating and in fact that is the function of, or one of the functions of the prostate glands. It actually produces semen, which is the fluid that the sperm can swim in and exit during ejaculation. It's about, I don't know whether you can see this, it's about the size of literally the size of a walnut. Normally it would be smooth and you know, but if the prostate has cancer, particularly if it's developed, it may be a bit knobbly, actually like a walnut is. So that's basically what a prostate is, and what it's there for, basically. Cathie will talk shortly about some of the other factors that can influence things going on with the prostate, but that's really basically what its function is.
And a prostate is something that only men or people assigned male at birth can have. So trans women may have a prostate. Next slide, please. But there are, of course, other conditions that might affect the prostate. An enlarged prostate is a common one and commonly presents itself in older men. Gil assumed that he had an enlarged prostate when he was having problems with going to the toilet, with stopping his flow, etc. Because his dad had an enlarged prostate. In fact, his dad had what's called a TURP operation, like a rebore of the prostate to allow the urethra a bit more room so it's not being squeezed as the prostate enlarges naturally with aging. So that's a common thing that a lot of older men get. But if you have those symptoms, you should still get checked. And we can't stress that enough throughout this talk, that the most important thing is any symptoms get checked, but you'll see later on that more than just any symptoms get checked. Another common condition is prostatitis. That's an infection or an inflammation of the prostate and commonly affects younger men, perhaps between 30 and 50. Of course, all these things can affect people at any age, but the common ages. Prostatitis or an enlarged prostate does not mean that you will be more predisposed to getting prostate cancer because you've had an issue with the prostate. But of course, if you've had prostatitis, in the same vein as anybody else, you should also get yourself checked in later life for prostate cancer. And then, of course, there is prostate cancer, which, as we've said, is the most commonly diagnosed cancer in men. Next slide, please.
Sorry, it's also the most common cancer in men.
It's the most common cancer in men. So how many people get prostate cancer? Well, 1 in 8 men, that's a high number. 1 in 8 men will, overall, will get prostate cancer in their lifetime. So if you're, got a group of friends, and it's quite a big group, somebody in your group is likely to get prostate cancer, maybe 2, maybe 3, depends on your groupings. That means 52,000 men will be diagnosed every year. It's always good if those 52,000 men are caught in the early stages, and we will come on to that as we continue with the talk. 10,000 men are still diagnosed too late. And one of the missions of prostate cancer is to make sure that men are not diagnosed too late. And that's part of the reason why we do our awareness talks and we do our awareness stands, is to make sure people are fully informed and do their own analysis of their risk and get themselves checked whether or not they're showing any signs or symptoms. Because if treated early, it's eminently treatable, and that is always a positive. So we will encourage people throughout to make sure that they do check their risk and get their tests. Next slide, please.
So this slide is saying here, well, I'd know if I had it right, you know. No, I'm afraid not. One of the key things about early prostate cancer is it does not necessarily have any symptoms. You can still be at risk, but not have the symptoms, and we'll come on to risk factors a wee bit later. But most men diagnosed with early prostate cancer can be successfully treated the longer it's left, obviously, and the same goes for lots of other cancers. Late diagnosis leads to less positive outcomes.
So a takeaway from this is, don't wait until you've got symptoms. And again, we'll cover that more as we move along.
Yeah.
Don't wait.
Don't wait. As I say, most men with early prostate cancer don't have any symptoms. So unless they're aware of the risk factors that we're going to look at, then they're probably unlikely to go near the GP. And there's also the issue, which again we'll talk about a wee bit later, that you won't necessarily get asked to come and talk about your issues with prostate cancer, and we'll come back to that one. So we would encourage all men to be proactive in seeking to talk to a medical professional about the risks of prostate cancer, and
about getting tested.
And about getting tested. We often say when we're talking to people, it's actually a win-win to go to the GP and talk about that, particularly if you're in the risk categories, but one of which is age. But it's a win-win, because if you go and you get a PSA test and that's normal within the range, then that's good news. You come out fine, good. If you went and then there was some issues with that, well, that's a win-win as well, because even if it turns out that it is prostate cancer, it's much more likely to be caught at an early stage, which, as Cathie says, is eminently treatable and very good survival rates. So it's a win-win, really.
Next slide, please. So who is at risk? We've spoken about age, and age clearly is a factor in terms of increasing risk. So men aged 50 or over are at increased risk. That does not mean, as we saw with Chris Hoy as an example, a very fit man, 48, was diagnosed with prostate cancer without symptoms that he attributed to the typical prostate cancer symptoms. So, but the risk does increase as men age. So one of the key risk factors is if you are aged 50 or over, but don't ignore any symptoms you may have before that. And could I have the next slide, please? Your risk also increases if you are a black man. We don't know why, though there's lots of research into these things, but black men are at twice the risk. So 1 in 4 black men will get prostate cancer in their lifetime. The risk is also increased if you have people in your family, close relatives, father, brother, who've had prostate cancer. So, for example, we have a son It's unfortunate for him that his dad's had prostate cancer, because that increases his risk by 2.5 times. So if men over 50 are at increased risk, it's also said that Black men and men who've got a family history are at increased risk, even more so. And if men over 50 should get a test, then men over 45 who are Black or have a family history of prostate cancer, or indeed of breast cancer, also increases their risk. So they should also strongly consider getting a test, with or without symptoms. Next slide, please. But you can check your risk within 30 seconds. You can see the QR code on there. This will come with the slides that Helen will send on, but also you can go onto the Prostate Cancer UK website and do the risk checker. It literally does take 30 seconds. It's 3 questions, and then it gives you some advice and suggestions. Any of the prostate cancer literature, like these cards that are just information cards, but have a risk checker link on the back. Encourage your friends, your family, people you work with, people down the pub. It's all about raising awareness and making prostate health something that men can talk about. I think for a lot of years, women have felt more comfortable about talking about their health, even if it's sensitive areas, because they've been so used to getting checks, going for checks, smear tests, mammograms, etc. It would be good to see men moving along at pace to that point where they talk about it and say, well, come on, you know, it's time we did. Let's all go and get a check. Next slide, please.
So if there's any questions so far, then please either give us some questions now, or if you prefer, Helen will put them into the chat, and we can sort of deal with those towards the end of the session. So just we'd be happy to field any questions that we can.
Helen, I don't know if you've got any questions that you think it would be good to do now. Otherwise, we'll move on and take them all together at the end.
Yeah, I think if anyone has any questions, please do pop them in the chat, and we can, you know, sort of go through those. But they may well be answered as we go along. So, yeah, at the same time, we can kind of, you know, sort of wait until the end. So, if you crack on, and if anything kind of comes up in the meantime, I can easily stop you and ask.
Okay, that's great. Thank you.
So just a bit more information about the PSA blood test. As I said earlier, it's called the prostate specific antigen. It's just a protein that's found in the blood that's secreted by the prostate, and it would have there's a sort of score. You know, if you're 40, it should be within that range. If you're 50, 60, and so on. So it's quite a good early indicator if things are not quite as they should be. It doesn't necessarily mean that a PSA is going to determine whether you've got prostate cancer or not. And there's also some issues which we haven't mentioned so far. If when you've seen your health professional going for a blood test, a couple of things. If you're a cyclist, you shouldn't cycle within probably 2 days of going for your blood test, because on the saddle it's kind of pushing on the area, and that will actually naturally raise the PSA level. And also you shouldn't have sex within the same period, because that also increases the PSA level.
And we have met people who've said that their doctor, when they book in a PSA test, will tell them that. But equally, the vast majority of people who've had a PSA test have never heard that information. So it is good to know that if you are thinking, or you know people who are thinking about having a PSA test.
Thanks, Gil. There was one question around how old you were, Gil, when you were diagnosed with prostate cancer, and are you able to share what your PSA and Gleason scores were at all?
Yeah, I can do that. Yes, I was 63 when I was diagnosed. Yeah, my PSA was 11 or 11.3. It probably should have been, well, around 4 or 5, if that. So there was clearly something going on. My Gleason score originally was 4 plus 3, sorry, 3 plus 4, which kind of means that the 4 was leaning towards being the slightly more aggressive bits that were being picked up. Once I had all the further tests, including a bone scan, just as a matter of routine, the team, they have their get together, all the people that have been involved in the test. They actually reduced it to 3 plus 3, you know, which it means it was probably not particularly aggressive. So that was where that was where I was at basically once I'd been diagnosed. Yeah.
Thanks, Gil. There's a few other questions coming in, but if it's okay, what I'll do is I'll leave them just a little bit to the end because really, you know, sort of good questions, but they may well be answered as we go along.
Yeah, that's fine.
The other point on that slide there is to stress that it is actually your right if you are at risk to have a PSA test. It's actually probably your right anyway. Any man over 50.
Any man over 50
is entitled to. Some of these things are maybe anecdotal, but we've come across them so often. And as our colleagues in Prostate Cancer UK, that some GPs, some health centres are still a wee bit reluctant to give a PSA test, particularly, and there's the irony is particularly if somebody hasn't got any symptoms. But it's quite clear, and the research is quite clear, that the majority of men with early prostate cancer, a lot of, sorry, not necessarily majority, a lot of men with early prostate cancer don't have any symptoms. So the refusal for a test, PSA test, is not helpful. It doesn't happen, you know, I'm sure in most practices, but it still does happen, and it's something that's talked about a lot with colleagues in Prostate Cancer UK.
We've heard quite a lot of people say that their doctor says, well, you haven't got any symptoms, or you're too young, you're only 55 or whatever. But as long as you are aware of you know, what the risks are and so on, you have a right to have a test over 50. And it is strongly recommended that if you are in a higher risk category, that you have a test over 45. Now, one or two people have said to us, what they have said if their doctor refused is, could I have that in writing? And then very often they will get the test.
Yeah.
But you can contact PC UK, and the specialist nurses will advise if you are told, no, we don't routinely do tests for men who are 50 or whatever. But there is also guidance, and some of these things we can send details of, but the prostate cancer, I'm looking this up to make sure I get it right. The Prostate Cancer Risk Management Programme gives advice to GPs about doing PSA tests. And increasingly, I think more GPs are more receptive to people having a PSA test. There's a lot more in the media, but people do have rights to have tests. And maybe it's easier now that we fill in a form to get our appointment, just to say that you've done the risk checker and you are whatever age and you think that you would like to have a PSA test because you are aware of X, Y, and Z, to actually be able to just write that down without having to battle to get an appointment through a receptionist who doesn't know the details. So hopefully it will get easier for people to have their PSA test without a bit of a battle.
Yeah, and as we said earlier, we consider it to be a win-win, because if everything's fine, when the question that came in there was, what was my PSA score? Mine wasn't fine, but if it's fine, it's a win-win. You come out of there thinking great, and if there's something going on, as it was with me, then they're on to it early, and I'm still here.
And it doesn't mean that if you've had one at 50, that's it. But it is a marker, and your future results can be measured against that marker. So that is also useful to know. And different GPs might have different views on how often is often enough to have a PSA test. It's a very simple test.
2 minutes.
Mm-hmm.
Yeah. Could we have the next slide, please? Right, now this is an interesting one, because this comes up time and time again, particularly when we're out doing sort of information stands. We did one near Newcastle United a wee while back when there was a football match on, and it causes a lot of mirth and macho humour between men, but it is a concern for men, and it's a concern that many men will not go to the GP to have a PSA test because of this, for some reason, this issue with what they think is having a finger up the bum and a DRE, a digital rectal examination. We're moved away from that, although many GP practices would still wish to do a digital examination. I didn't have one.
No. Well, 15 years ago, you didn't have
No.
one. But our son, when he asked about
this year,
was told that that would be part of the examinations that they do, including the PSA test. So it varies from practice to practice. But you have a right to say, no, I don't want that particular test. Or indeed, if your practice doesn't do it, can I have that particular test?
Yeah. And because it's such an obstacle, which we all come across when we're out there trying to raise awareness, Prostate Cancer UK have actually, I don't know whether you can read that, one of the free cards that we have is this one, which just says you don't need a finger up the bum to test for prostate cancer. And again, there's some advice on the back about getting a PSA test. We often say as well, if we could get into this discussion with men, is don't die of embarrassment. For the sake of not going because you have this issue with that, you don't go, then sadly many men will not go and will go on to have prostate cancer,
or put off,
yes.
So that instead of being diagnosed in the early stage, far more treatment pathways available to you. Men put off, and then when they are diagnosed, then those pathways are considerably reduced.
Yes.
So don't die of embarrassment.
And the pathway that Prostate Cancer UK are now saying should be the pathway, and they do a lot of work with health professionals, and I think we're moving very much in that direction. The order of play, if you like, should be, first of all, PSA test, secondly, an MRI scan. It's actually what they call an MPRI scan now, which is far more precise, and if necessary, then a biopsy. A much more thorough test, because if you just relied on the finger up the bum, because you're actually feeling that through the lining of the back passage, you're only feeling one part. The prostate, the cancer could be dominant in the other side of that, which wouldn't show up. So the scan now is so accurate, it can do that. And then if necessary, they want to follow up with the biopsy, it can be located much more precisely where they want to take the samples from.
Next slide, please. Okay, so time just to look at some of the myths, some of which we've covered already, some we haven't. So we commonly hear that prostate cancer is a good cancer to get. We still hear that quite a lot. But it's not a good cancer to get if you're one of the 10,000 men diagnosed too late for treatment pathways to be broad and open. You don't want to be one of those men who die because you're diagnosed too late.
And that's actually overtaken breast cancer now.
Another common myth is that the GP will invite a man for a test if they're at risk. Well, they won't. There is no screening program, and very often there's no connection. Say if your dad had prostate cancer, there's no connection to you that your dad had prostate cancer. So the GP won't necessarily know that you are at increased risk. They'll know your age, but they won't necessarily know other factors that might increase your risk. So you do not get invited for a test. There is no screening program currently. And a lot of people think, well, that's an easy thing to solve. It isn't an easy thing to solve, because a screening program, we need to be clear about the accuracy of that program. And there's a terrific amount of work being done on that very issue. And I'm sure at some point there will be a conclusion to that that will be of benefit to all men. All men are at the same risk of prostate cancer. Well, we've talked quite clearly about that. Black men, for example, are double the risk. Men with a family history are at increased risk. Older men are at increased risk. So people aren't at the same risk. And it's important that each individual knows their own risk. And I shouldn't bother my GP unless I've got symptoms. Well, Gil's mentioned it several times, and we can't mention it enough, really, that often early stage prostate cancer has no symptoms. So don't think that you have to wait for symptoms. It's best to find out early with no symptoms than to find out later with symptoms.
Yeah. Can I just say also that there's still quite a lot of confusion with men as well. You know, a lot of practices do well-man clinics and will do blood tests. By and large, these do not, unless requested or insisted upon, include a PSA test. So we often get men who will say, no, it's all right, I'm fine, I've been tested, because they've been to a well-man clinic. Or the other confusing issue for some men is that they have done the bowel cancer screening thing, you know, the one that comes in the post, and they confuse that or associate that with also dealing with the issue of a blood test for prostate cancer.
And that comes up really often.
Very often.
That people think it's okay, I've been done, but actually when you talk to them, they haven't had any test for prostate cancer. So don't assume unless you know specifically and you get the result specifically that you have had a test for prostate cancer.
No. Can I just, before I forget, just make a plea, because I don't think it's going to come up on the other slide, for the role of partners in the detection or the encouragement for men to go and get a PSA test. For example, you know, I probably wouldn't have gone if Cathie hadn't, I wouldn't say nagged, because she doesn't nag.
Repeatedly asked.
Yes. when I was having some waterworks issues back then, and that comes up time and time again. And also when we're out doing our information stands with our free cards and things, and we're trying to ask people, would they like some information? Men will walk past you and say, no, I'm fine. Well, I don't know quite how they know they're fine, but if they're with a partner, a woman, then the woman will often say, I'll take that.
It really is very common.
Oh, it's so common.
And one of the things we've also noticed more recently is mothers of sons talking to us about educating their sons. Because if the fathers aren't talking about it, mothers tend to talk to their daughters about breast cancer, but they don't necessarily talk to their sons about prostate cancer. But we've had a few occasions recently, a growing number of occasions, where mothers have said, I need to know more so I can talk to my son, so that my son is more aware and knows when to get checked. Because we all encourage daughters to have the smear tests, have the mammograms, etc. But sons need to be aware, and to be aware from a younger age, as women often are at a younger age. So there's a role for both. There's a role for men supporting women with their health issues, but it works both ways there. Could we have the next slide, please? So where can you get support? Support to know information, and support if you are diagnosed with any issues of the prostate. So if you had an enlarged prostate, you can go to Prostate Cancer UK for help and information. Prostate Cancer UK has a wealth of information and printed guides and handbooks and online information on their website. We'll send the links to Helen and she can send them on to you, or you can simply type in Prostate Cancer UK and work through the myriad of stuff that's on there. A particularly good resource through Prostate Cancer UK is the specialist nurses. They are what it says, they are specialists, and they can be very helpful to people. Say you couldn't get a PSA blood test through your doctor, talk to the specialist nurses about what the current guidance is. They would pass that information to you. If you have a diagnosis and you've got 3 treatment pathways, the specialist nurses would give you information on each of those pathways. They won't tell you what to do, as we would all like people to do, but they would be able to signpost information for you so that you can forewarn yourself and forearm yourself with questions that you might like to ask at appointments.
Yeah, sorry, could I just also say that something that can be quite common is that sometimes the man with prostate cancer has difficulty talking to his partner, and would like to talk to somebody who's kind of outside of that, just to find it easier. And the specialist nurses are particularly skilled at doing that.
Oh, and whether or not you find it difficult to talk to your partner, you might still want to talk to someone else.
That's right. Yeah.
And also the specialist nurses facilitate a one-to-one telephone service where you can be put in touch with another person. And if you're a man with prostate cancer, you can be put in touch with someone else who's thinking about the same treatment. Sorry, you could be put in touch with someone who's had the same treatment that you're thinking about, so that you can see it from a human's point of view rather than a medical point of view. The person that you put in touch with, it might be Gil, for example, because Gil and I both do the one-to-one telephone service. Gil would only be able to tell you his story. He wouldn't be able to advise, but he could say, how it impacted him. And I could talk to the partner of someone who'd had a similar a journey to the one that we had. So
Thanks, Gil and Cathie. That's absolutely amazing. I'm just very conscious of time because we've got about 10 minutes left and there's quite a lot of questions. But I think this is your last slide anyways, if I'm correct, isn't it?
Yep.
So we will make sure that when the slides come on, it's got all the access to the information about the website and all those really, really useful resources. I know, for example, with ourselves, you know, we've signposted people to Prostate Cancer UK for advice when they've been having, you know, sort of issues getting that PSA test through the GP. So thank you so much for that. Is that your last slide now? Or do you want to go to the next slide? Any questions?
That's fine. Yeah, questions was good.
Excellent. Tim, if you can just stop sharing now. There we go. Lovely. Thank you so much. That was amazing. And it's really, really, you know, sort of good to hear, you know, sort of personal stories. And I think that, you know, the fact that there's a lot of questions in the question and answers kind of show that people are very, very interested to know more. So there's a couple of questions that are kind of similar in some respects. So I think you already covered this. It's about kind of what age are Black men recommended to get tested even without symptoms. I think you said 45, and there was kind of a related question, I guess, around kind of, is it possible that Black men might be less likely to go to GP if they have symptoms? I don't know if there's any research going on about reluctance to ask for PSA tests in particular, you know, sort of demographics or anything like that.
I don't know specific statistics, but I think anecdotally,
yes, and there are some cultural issues there, yes.
But it's about 45 is usually the recommendation. And someone's asking about who manages the PSA tests, you know, sort of subsequent to, you know, sort of your diagnosis and treatment. Is it the hospital or GP now? And are there any other professionals that are involved with your aftercare, Gil?
Well, initially, for the first year, it's certainly when mine was back in 2010. They did the PSA test. I had to go to the Freeman to get those done, really, so that they're done on the same.
This is the follow-up.
The follow-up. This was done on the same technical equipment that they had there, rather than at the GP end or where the GP send it on to. Subsequent to that, I just go get mine done at my local surgery, and that's sent off, and it comes back literally within a couple of days. Yeah.
Excellent.
So, and also, sorry, you said, and what you say about
just, I guess it's that question around, you know, have you had any other, you know, sort of professional involved, or is it now that you're just kind of discharged, you're just now under the care of your GP?
Yeah. And there are other professionals, because some of the side effects of the treatments you'll need to access some other services through the NHS. For example, one of the common symptoms of treatment for surgery and indeed for radiotherapy can be issues to do with continence, and can be due to issues to do with erectile dysfunction. But those services are available within the NHS, so a lot of men will access those.
Yeah, and that should be directed presumably from your GP or the consultant that you're under. Yeah. I guess there's a question around, I think it's about prevention really. So it's saying that if you are at high risk, is there anything else that you can kind of do to reduce that risk, or is it more just making sure that you know, sort of go to your GP for tests?
Yeah, it is the latter, but with all issues to do with health, the main recommendation is, you know, try and live a healthy lifestyle, you know, diet.
Don't be overweight is a key.
And there's some research which is strongly showing that people who are overweight are perhaps more likely to get a more aggressive form of prostate cancer. So
that's common with a lot of cancers, that there's a higher incidence amongst people who are very overweight or obese. So keeping healthy, doing all the things that you know your body should take in terms of your diet and so on, is always a good thing, and keeping as fit as possible. but it's not a you keep fit, you don't get prostate cancer. It's not that sort of correlation, and we can only do things that we can do.
That's fine. And thanks for that. There's just a couple more questions in. So I guess one's talking about if someone like a father has prostate cancer and, you know, sort of the son is at, you know, sort of higher risk, do GPs ever sort of recommend any sort of like genetic testing, you know, sort of around that?
No, not at the present. That might come along, but it's not there at present. I think the other thing is, you know, like many things, a lot of people don't know their family history. You know, particularly, you know, going back to the last generation who perhaps died younger, or grandfathers. It wouldn't necessarily say what you know what they died from. You know, so they're not necessarily going to know that. But the key things are, yeah, fathers, brothers, some cases uncles. We know a family where it's all three. So that's basically just being aware of that.
Yeah. And lastly, although there might be some questions kind of coming in, can you explain how the TURB operation helps with prostate issues, please?
It's a TURB,
transurethral something or other.
I can't remember.
But you know, to go back to the diagram, the pipe, the urethra going through the prostate. When the prostate enlarges, it just doesn't just go outwards. It enlarges inwards as well, so that kind of presses on the urethra. Cathie described it as a rebore. That's like we used to do with our cylinders on our cars, you know.
Just make the passageway bigger in the middle.
yeah. So and that was one option that I had, because mine was enlarged as well. But one of the reasons I went for surgery was I'm going to have an operation for a TURP. I might as well go for the full Monty, you know, and have, you know, have the radical prostatectomy.
I'll see if there's any other questions kind of coming in, but thank you so much for coming along. It's been really, really, really useful. And I think the fact that we've had so many questions is, you know, sort of really good, that, you know, sort of people are asking. Someone's asking about transport to the Freeman in terms of how many miles you had to travel to the, you know, sort of Freeman. I think as Health Watch, we quite often hear about, you know, sort of people having to, unfortunately, you know, sort of travel quite long distances for treatment. And I know that you're up in the north of the county. So I guess that's a question around really, you know, the fact that there wasn't like any local, you know, sort of provision to you, I guess.
No.
Because that's where the treatment.
Yeah, that would still be the case.
And we were fortunate we could do that.
Sorry, having said that, yeah, in my earlier stages of diagnosis, that was actually at Ashington.
Right.
I had my biopsy at Ashington and my flow tests and all of those things there.
So probably about a 50 or so mile round trip, I would imagine, something along those lines. Someone just saying thank you for the information, be passing it on to patients. Her dad had prostate cancer and caught it at the early stage. He used sort of patient transport, including, well, it was staffed as a brush actually, so it wasn't patient transport, it's a charitable service. I think there are other sort of services as well. So, you know, up in the north, there's the Berwick Cancer Cars, and there's also a new one as well that we can send out with this. I think it's healing. Yeah, I think it's something called the healing hands, maybe CIC, but we can maybe get that out as well if it's, you know, useful to people.
One thing I didn't mention, Helen, was that there are some support groups for people who've been diagnosed or been treated, and there's an organisation called Tackle Prostate Cancer. It's affiliated with Prostate Cancer UK, but it manages the support group side. And I'll send a link to that, because if people wanted a support group or wanted to say to someone, well, you might like a support group. I mean, the nearest for us would be Maggie's, but in Newcastle. but they have a website. You can just type in where you live and it'll tell you the nearest support group. And also they do have an online support group for people who either can't travel or the travel's too far or whatever. People who meet who've had an experience of prostate cancer themselves.
Yeah, no, that's great. And I know that, you know, sort of, because I've done engagement events with Gil, you know, sort of on many occasion, you know, sort of, so, and I know you're very keen to, you know, sort of offer out, you know, sort of information stands. So if there's any professionals, you know, on this call who, you know, sort of want to get in contact with Gil and Cathie to, you know, raise awareness locally, you know, sort of Prostate Cancer UK, please do get in contact with us, you know, at Healthwatch Northumberland, and we can, you know, sort of put you in contact. That's not a problem. Also, what I would say is if there's any questions that you haven't wanted to ask in this public forum, but you want to kind of ask, you know, sort of separately, again, please do, you know, sort of contact us. I'll just put our email address in the chat there so people can get that up. And it's great that you're doing the, you know, sort of awareness raising of the public, and I'm sure that Prostate UK are doing more general raising awareness with GPs and clinicians and all of those things around, because it's not just, is it, about sort of you know, getting regular access to the PSA test, but it's also those things that you mentioned around, you know, sort of actually people passing on what people can do to get a more accurate PSA test, because you're obviously saying that, you know, a lot of people don't realise that, you know, sort of they can't have sex before or, you know, sort of cycle. So it's all of that sort of stuff that I would imagine the prostate cancer are working towards. Yeah, I'll just put up.
Sorry, we sometimes abbreviate Prostate Cancer UK to PCUK, but if you put that in, you'll get the Pony Club of Great Britain.
So yes, type it fully out and then you'll get it. So yeah, we've had a link in the chat there as well. Healing Wheels is the transport charity of cancer patients. So thank you so much for coming along, everybody. I know it's been a really, really hot day, so it is much appreciated. If you check our website on the online sessions, the recording should be there next week, and we'll also send on the slides. And Gil and Cathie, thank you again for coming along to talk to us all today. It really has been much appreciated.
Oh, thank you, Helen and Tim, for facilitating it, and hopefully, you know, that's just done a little bit to make people a wee bit more aware of this. So it's been really good to do it. So thank you again.
Thank you, and thanks very much.
Okay. Bye.
Have a nice weekend, everybody.
Bye.
Bye.